The Brain Injury Guide and Resources is a tool for professionals, community members, and family to understand traumatic brain injury, as well as how to promote better living for those who live with a TBI. In this interview, we will talk with Barbara Brinkman, Clinical Associate Professor in the Department of Communication Science and Disorders in the MU School of Health Professions, to learn more about the role of speech therapy after a brain injury. Barbara, thanks very much for being with us.
Oh, I'm happy to be here.
Barbara, when does a speech therapist become involved with a patient following a traumatic brain injury?
They usually get involved very early on after the accident. Sometimes they'll even begin working while the patient is still in a pretty deep coma, doing some stimulation to try to help get them out of that stage of coma. And even in the early stages of emergence, we start to work. They have a lot of social communication and just communication problems in general. So we work on reading, writing, listening, speaking, swallowing, and speech disorders as well.
Mm-hmm. What are the goals of speech therapy?
Well, you really want to integrate the person back into their former life as much as possible. So it depends on the patient. If it's a school-aged child, you want to integrate them back into the school system. If it's an adult, back into their work situation if possible. And of course, for everybody, you want to help them get back into a social relationship with their family and friends.
Mm-hmm. What kinds of things would a speech therapist do to help a person with a traumatic brain injury?
Well, we're going to work on all those areas that I mentioned before, but there's going to be a lot of emphasis on the social communication domain. What we find is that even when people start to recover their language, they have trouble using that in social situations. So they may have difficulty understanding how to start a conversation, how to maintain it, and how to end it. They may have trouble matching the appropriate loudness level when they're speaking to others, and they don't have good self-monitoring skills to modulate that. And finally, they may have trouble with things like figurative language or higher level language skills when the words don't match the message that they're trying to convey, like sarcasm or metaphors.
Mm-hmm. Are there specific techniques you would use with a typical client?
Well, I try to use a lot of cueing systems that are other than just listening, since they may have some problems comprehending. So I'm going to pair cueing systems with visual things, maybe doing some videotape or audio tape review to help increase their awareness of some of their deficits. If they're not aware that there's a deficit, they're not going to be able to make many changes there.
Mm-hmm. So Barbara, is there a difference between working with children and adults?
A lot of the areas are going to be the same, but one thing that's really important to keep in mind is that people who have had a traumatic brain injury have trouble with learning new information. So if you look at an adult, they've had many, many experiences that they may not have lost. But a child's had fewer opportunities to learn, and they're going to have trouble learning all the new things that are going to come up in school. So you really have to have a lot of intervention for these kids.
Barbara, how long would the therapy typically last, or is there a typical length?
You know, it's really hard to give any specifics for any particular patient, but I'd say probably at least 1 to 2 years. It depends on the severity of their injury. It depends on what their goals are too. Are they just wanting to work at home? Are they wanting to get back into a workforce? Are they school age? So all of those things are going to come into play.
All right, well, let's take a look at how you might interact with a client if we could.
Okay, I'd be glad to do that.
And joining us now for our demonstration is Leanna. Leanna, thank you very much for being with us. And Barbara, at what point in the therapy would Leanna be in our situation here?
She would be about 6 months after her traumatic brain injury. And we're working a lot on her conversational skills at this point.
All right. And what therapy goals would you have for this session?
Well, we want to increase her ability to communicate socially with friends and family and that sort of thing. She has a little bit of trouble keeping a conversation going, and also sometimes she doesn't modulate her voice real well. So we are still working on that too.
All right. Show us how you would work with this client.
Okay, great. Hi, Leanna. I haven't seen you since last week. How was your weekend?
It was good. I saw my family.
Okay, Leanna, remember now we're having a conversation. And do you remember this chart from last week? When we start, I made a comment and asked you a question, and that came over to you. And you made a comment, and that was great. But you need to get the conversation back to me. So what do you need to do?
I need to ask a question.
That's exactly right. Okay, so let's try that again, okay? And look at the chart if you need to help you get through this, okay? So I'm going to start again.
Okay.
Hi, Leanna. I haven't seen you since last week. What did you do over the weekend?
I saw my family. What did you do over the weekend?
That was perfect. That's exactly what I wanted you to do. That turns it back to me and it keeps it going back and forth, just like a good conversation. Okay, now ask me that question again.
What did you do this weekend?
I saw my granddaughter, which is always a lot of fun for me. And we put up our Christmas tree. Are you putting up a tree?
I haven't yet, but I'm going to.
Fantastic. That was a really nice conversation. Went back and forth, okay? Terrific. Let's move on now, and I want to work a little bit more on your voice and how loud you are. Sometimes you're a little too loud, and that's way up here if we look at this scale. And sometimes it's really hard for me to hear you. You tend to get too quiet, okay? Somewhere in the middle is what we want most of the time, okay?
Okay.
So I'm going to demonstrate this a little bit to you. I'm going to say a sentence, and I'm not going to tell you which one. I want you to tell me if it was too soft, just right, or too loud.
Okay.
You ready? Mm-hmm. Okay. Hi, Leanna. How are you?
That one was too loud.
It was too loud, wasn't it? How did it make you feel?
Maybe a little uncomfortable.
Yeah, and I think that's what happens when people don't use the right tone of voice. If it's too loud or too soft, people, they get uncomfortable with that. Okay, how about this one? Hi, Leanna. How are you?
I'd say that one was too soft.
That's right. You're exactly right. You're getting really good at determining whether something is too loud or too soft. So let's see now if you can produce it in the right way. I want you to ask me, how am I? And I'll tell you if I thought it was too soft, too loud, or just right.
How are you, Barbara?
That was pretty good. It was a little bit soft. I'd put it right about in here. I'd like you to try again and see if you can get it a little bit closer to the just right.
How are you, Barbara?
That was very nice. That was just the right level. Can you do one that's too loud?
How are you, Barbara?
That was really loud. Good. You're really getting good at judging and producing these. That's terrific. Thank you. All right, Leanna and Barbara, thank you very much for being with us. We appreciate it. And we thank you for watching this interview on Speech Therapy After TBI, a service of the Brain Injury Guide and Resources.